Hello everyone, welcome to Food and Mood, where we will explore nutrition's role in mood and mental health. Starting with our land acknowledgement, we acknowledge that the lands which Newfoundland and Labrador Health Services sites are located on are in the traditional territories of diverse Indigenous groups. We acknowledge with respect the diverse histories and cultures of the Beothuk, the Mi'kmaq, the Innu, and Inuit of this province. I'm Kathleen White. I'm your presenter today. I'm a registered dietitian, a clinical dietitian with Newfoundland and Labrador Health Services. I graduated from Memorial University in 2009. I started my career in Nova Scotia, and since that time, I've been working in BC, Ontario. I've returned to Newfoundland in 2013, and I've been working in St. John's in a variety of practice areas since. That's actually inaccurate. I no longer work in St. John's, sorry. I just recently moved out into a more rural area. So I've worked with all ages and demographics, inpatient, long-term care, rehabilitation, and outpatient settings. And right now I work in primary care, and my passion is the prevention of disease through early intervention, knowledge, and skill building. I have no disclosures to make. What is a dietitian? So a dietitian is a title that is protected by law across Canada and other countries. Our training is standardized and accredited, and we are required to keep learning throughout our careers to maintain best practice, safety, ethics, all of those really important standards. The Newfoundland and Labrador College of Dietitians has a great website. I definitely recommend going to visit there to learn more about the scope of and the role of dietitians. You can check out the Where Do Dietitians Work page for further information, and another great option is Dietitians of Canada or unlockfood.ca as a website. Today's session is recorded. It's part of the Wednesday Wellness series that is being offered on the Bridge the Gap webpage. And you can pause anytime you need to, and I want you to be comfortable throughout. So, that's the great part about watching a recording, is that you can come back to this as you need to. I'm going to do a quick overview of what to expect now today from this recording, and then we'll get started. So part one is going to explore how nutrition impacts mood, understanding what malnutrition is, how it impacts our food choices, using mindfulness to help the food and mood connection, and exploring hunger, satiety, and appetite. Between parts 1 and 2, we are going to take a 5-minute pause, and we're going to do a mindfulness exercise. So just be prepared for that. It really helps if you have something that you can use for the mindfulness exercise, which would be a piece of food, something small that you can hold in your hand easily, something that can sit on the corner of your desk for a little while without, melting or something like that. And it doesn't have to be much, doesn't matter what it is. It's all about the connection and not necessarily about what the food is that we're connecting to. So part 2 is going to be put it into practice. We're going to explore nutrients that boost mood, nutrients that we may need to moderate, how to choose carbohydrates, what is regular eating, and how do we balance our appetite, what is balanced meal planning, how do we approach hydration, what are SMART goals and how do they help us make change, and what are some reliable resources to refer to when trying to make any of that change. So our goal of this session today is that we're going to learn of routines that promote improved mental health. We're going to discuss the connection between nutrition, health, and mood. We're going to learn of how to improve connection with food through mindfulness and self-care, how to improve awareness of appetite, hunger, and satiety, how to improve awareness of typical nutrition and hydration choices, an area for improvement. I mean your own typical nutrition and hydration choices and where you may want to make some changes, and how to approach making change, learning strategies that help us approach making change. I always like to just take a minute to reflect on the topic at hand, and that this can be a heavy topic of conversation for some people, depending on what your particular nutrition history is, your relationship with food and eating, your relationship with your body, you know, any number of different things. So it is recommended that you do something nice for yourself after this session. So I said get cleaned up. Sometimes that might be a hot shower, that could be a nice long soak in the tub, whatever. But just, you know, getting a little bit of a reset sometimes helps you just cleanse your palate. Call a friend or a family member, especially if that's someone who you find that fills your cup. Calling that person, don't call someone expecting them to fill your cup if they always drain the tub. So watch a feel-good show that makes you laugh. Kitchen dance parties, always recommended. Doesn't have to be inviting all kinds of people over. It can just be your favorite song while you're drying the dishes. Do some light stretching, have a nice cup of tea. Ideally not caffeinated if you're not working a night shift and thinking about how you might want to go to bed soon. Okay, so we're about to dive in. Does nutrition impact our mood? I don't think there's any question about this. I think we all know that it does. Absolutely it does. And we don't need to look any further than the word hangry. Hangry, I'm sure we've all heard of it before, but if you haven't for some reason, it's to be irritable or angry because of hunger. Our meal patterns do impact our mood, our energy, and our mental health. I have always found the Minnesota starvation experiments really interesting in how it changed how we started to explore nutrition and its connection to mental health. So we're going to discuss those briefly. And ultimately, what I want you to take away from this is that eating more of what we need for our adequate nutrition can actually help us reduce our irritability and the fluctuations in our mood up and down, up and down. So that's our goal, is to improve mood through this session. And hopefully to identify nutrition strategies that help us do that. So in order for us to talk about how nutrition impacts our mood, we need to discuss malnutrition. Malnutrition includes both the deficiency and excess or imbalance of energy, protein, and other nutrients. Just wanted to make sure that we were in fact recording. So it's important for us to slow down on that, because a lot of people, when I talk about malnutrition, the first thing they assume is that it's inadequate nutrition of a severe degree. And it can be the inadequate nutrition, it can also be excess, or it can be an imbalance. And all three of those scenarios can have pretty dire consequences. So we want to make sure that we're taking stock of our nutrition on a regular basis and checking in to make sure that we're getting all the right nutrients, certainly on a regular basis, and that your pattern of eating supports a good mood. It's also really important to understand that you can be very malnourished in a large body and you can be adequately nourished in a very small body. It doesn't have to be starvation to be malnutrition. And it takes training and skill to assess someone's nutritional status. You can't just rely on blood work or their physical appearance. It's really a comprehensive whole person assessment that identifies whether or not a person is malnourished or not malnourished. So in this little diagram here, we have some of the indications of malnutrition. And this is just a small handful of things. So we're going to see things like weight changes, weight loss, weight gain, or maybe weight gain followed by weight loss. We might see fatigue and weakness, reduced tissue quality, impaired hormone and immune system function. We might see delayed wounds that struggle to repair. We might notice that people are having difficulty focusing or making decisions. They might demonstrate having lethargy and apathy. These are all, very classic indications of a malnutrition or a nutritional imbalance. So there are long-term effects and there are short-term effects. And I've also heard this described as long hungry and short hungry. So long-term effects, homeostasis protects us from consequences of malnutrition, but that has its limits. So if you've heard of homeostasis before, homeostasis is a biological drive that we're all born with that resists change. So when we experience too little or too much of a nutrient, our body has ways to adapt to accommodate that to a degree. But once we reach the extent or the limit of what we can adapt for, then we start to experience consequences. And sometimes those consequences seem unrelated because our body has a really interesting way of moving things along or finding a way forward. So imbalanced or inadequate nutrition creates a need for change in our body that can cause problems for us. So when we regularly eat imbalanced nutrition, our body is building and maintaining its tissues and the ability to function normally the best way it can, but it's being heavily impacted by the quality of the nutrients that it's getting. No matter how you've been eating, however, today you're learning new information, and every day there is an opportunity for us to make an improvement because cells turn over in our body every day, building new tissues, improving systems. So we can't go back and fix what was done, but we can always move forward. So as we talked about, if we've been consuming too much of a nutrient for a really long period of time, it can cause stress and or imbalance in our body. Examples of that would be deposits of a nutrient in our body, like in a way that we're not able to handle, such as kidney stones, for example. Another example of what would happen would be high blood pressure. So when we eat too much sodium long term, our body has to try to figure out a way to reduce how much salt is in the body in order to maintain homeostasis. So our blood pressure increases and our kidneys work harder. So yes, we can eventually find a way to adapt or manage this situation, but at the cost of more pressure in your vascular system than your body is really designed for, and more excretion of wastes and fluids from your kidneys than your body is really designed for, which means that those organ systems are going to experience dysfunction or disrepair at some point. So that's why it's really important to understand in the short term, these things are not an issue. In the long term, when things are done consistently, these things become quite the issue. So similarly, too little of a nutrient, we ask our body to figure it out by robbing Peter to pay Paul. And so this can mean poor tissue quality, low function of an organ system, but it can also create traffic jams in our metabolism and decrease the quality and function of our organ systems as a whole. So it is important for us to be aware of what our really important nutrients are and be sure that our eating patterns are providing a way for us to access those nutrients. So going long periods of time without eating affects our mood, and there's no question about that. But let's look at why. When we are hungry, and sorry, it says short-term effects on the top of this slide, and then it refers to long periods of time. So when I mean long periods of time on this slide, I mean periods longer than 6 or 7 hours. I'm not talking about 6 or 7 days. So if we go really long periods during the day, especially if we're active and functioning in our life, working our job, taking care of our children, studying our school, or doing our housework, participating in sports, any of those things, if we go long periods of time, we're also going about our activities of daily living, we're burning up a lot of energy, and that's going to affect our mood. Because when we are hungry, we have a biological drive to be more irritable, aggressive, and effective hunters and gatherers. That's something that we developed in order to help our survivability in a time when food and resources were very scarce. And that concept has been used by dieting and wellness culture to encourage people to always be on the cusp of hunger. And that helps them optimally perform and be most well. And it's just not an effective way forward. We're going to talk about now some of the things that were discovered through the Minnesota starvation experiments. Believe it or not, dietitians, doctors, researchers did not always know how to help people rehabilitate themselves and recover from malnutrition and starvation. So there was a research protocol that occurred after the First World War, during the Second World War, where there were a group of people, men in this case, who did not want to participate in in war, but they wanted to support the war effort. They were conscientious objectors. So they participated in starvation studies to help researchers and physicians understand how to support people returning back from the war. So the research protocol called for the men to lose 25% of their normal body weight, which is quite significant. And I have patients come in all the time that have lost about or more than that amount of weight in interest of trying to be more healthy and more well. They spent the first 3 months of the study eating a normal diet of 3,200 calories a day, followed by 6 months of semi-starvation, and then a restricted period of rehabilitation of eating 2,000 to 3,000 calories. and finally an 8-week unrestricted rehabilitation period. So ultimately, what they studied this for was to help make sure that they could safely help people get back to their normal weight after experiencing something like war, an illness, and injury. And throughout the experiment, the researchers measured physiological and psychological changes brought on by near starvation. So the thing is they were very fully ready to understand and study this physiological changes, like low heart rate, thinning hair, weight loss, weakness, all of those things. But what they were not prepared for and what they were really fascinated by was the emotional, psychological, and social changes, cognitive changes. It was very clear that malnutrition and starvation impacted these people in ways that nobody really previously could understand. And when you look back at what I described, I have patients come into me all the time that are eating far less than 1,500 calories, thinking that it's the right thing for them to lose weight in order to be healthy and well. And they've been doing these patterns, extended periods of time. And, significant reduction in nutrition over a concentrated period of time is clearly associated with increases in low mood, anxiety, irritability, apathy or loss of interest in life, reduced sex drive. We also see people start to show more rigidity or obsessional thoughts and thinking, impaired concentration, difficulty making decisions, difficulty comprehending things, struggling with their alertness. And then over time, these things kind of moved into withdrawal and isolation from their social groups, loss of their sense of humor, loss of their personality, starting to feel socially inadequate and low self-esteem, withdrawing from family, neglecting personal hygiene, strained relationships. Another thing that they talk about a lot is how much this impacted eating behavior. So instead of seeing people return to normal eating, there were a large number of these people that demonstrated, or not a large number because it wasn't tons of people in the study, but there was a significant number of the participants who demonstrated overeating or excessive eating in the recovery period. Even though they had consistent, regular, free access to food, they were still overeating for an extended period of time, driven by some internal biological drive. So it's really, really important to understand that our eating pattern has the capacity to greatly impact our mood. We are far more likely to make snap decisions and choose foods that don't align with our nutrition priorities when we are over hungry. So it's important for us to know at what intervals is a good idea for us to eat with, and what we are more susceptible to when we've gone past that point. So we're far more likely to choose convenience and snack foods that are highly palatable once we've moved into extreme or significant hunger. We're more likely to use vending machines, stop in a drive-through, hit the donut box, and rely heavily on pre-made or packaged foods. And while these foods do give us quick energy and something is better than nothing, that's why we choose them, if we rely too heavily on these foods frequently, they make up a large portion of our food choices. That means that the quality of our nutrition has gone down from a couple of perspectives. We're not getting the vitamins, minerals, fiber, antioxidants, phytochemicals, hydration, prebiotics, fermented foods, all of that stuff that really supports health and wellness and even mood and strong mental health. And we are getting an excessive amount of nutrients that actually do interfere with the quality of our mental health. So refined and added sugars and carbohydrates, sodium, saturated and trans fats. So how do we feel when we immediately eat food? It's going to be highly influenced by the situation and the person. A person's personal experiences, their sense of self-worth, their history or trauma, learned experiences, these are all some of the things that are going to influence how we feel after eating. It truly is very individual and can change from day to day and from moment to moment. So how we feel when we're eating and after having eaten is going to play a big role in our relationship with food and our relationship with eating. Large portions of food, sorry, I'm skipping something. So eating foods high in refined carbohydrates, lots of salt and saturated fats, trans fats, can create a large influx of nutrients into our bloodstream in a very short period of time. And that can create an energy rush and a crash. So it can feel very, very uncomfortable, and we don't feel really motivated to jump up and be active and get back to our to-do list and things after eating a meal like that. So large portions require your bloodstream to go to your abdomen to support digestion and absorption, and that can leave you feeling tired and sluggish after meals. So it's important for us to make sure that we're eating regularly so that we're not having to eat large amounts when we do eat to kind of make up for the difference. A person, remember, is much more likely to eat a large portion when over hungry. And they're much more likely to choose quick acting, more processed, more appealing, and less nourishing choices. So going back to how food makes us feel, we might actually not have a clear idea of how food makes us feel, either because we don't care, it's really not that important to us, or because we care quite a lot and we've actually had to dissociate from how we feel, or not necessarily dissociate, but distance ourselves or avoid connecting too deeply with how we feel around eating in order to manage some other aspect of our life. We often have a lot of thoughts going on in our head, and depending on what we have going on, we could be doing things on autopilot. We might not even be realizing that, we've missed our turn, or we don't know why we just came in a room, or, we didn't even realize we were almost done the bag of chips that we were just eating. So mindlessness, or not being mindful, can happen for any number of reasons. We could have just been eating really fast. There could have been a lot of distractions in our environment. We could have been in a mood where we're just, not really in a place where we can connect with eating. We could be really stressed and have very limited opportunity to eat. But these are things that directly impact our connection with food all the time. And it's really important to understand that if we're not deeply connecting with eating, we're not receiving all of the sensory input that comes into eating, and it can also play a role in our satisfaction. So mindfulness is something that gets discussed a fair bit when we talk about our relationship with food and mental health and nutrition and food in the context of mental health. So mindful eating is about paying attention, doing things with intention and without judgment. So it's really important, no matter what it is that you've set aside for your mindful eating practice now in a few minutes, it's really important for you to understand that it has nothing to do with how health promoting or non-health promoting this food is. Whatever it is, we accept it without judgment. We're just there to notice. So the goal is to focus a person's sensory awareness and their connection with it throughout the experience of eating, to form a deeper connection and to improve awareness of how you're responding to a food, and ideally enjoy and appreciate and be satisfied by food in a more effective way. So we are going to focus on the sensory awareness of the food, and this increase in the awareness of sensory input helps to develop stronger neural pathways, so brain pathways. And that can help us be more aware of our hunger and fullness cues. We're going to discuss the hunger scale in a fair bit of depth throughout the last 2/3 of this presentation. So if you're not really comfortable talking about hunger and fullness or don't really know what that means, you will in a few minutes. Anyone can improve mindfulness during eating. There's no such thing as a beginner, an intermediate, or an advanced. Every day we eat, or ideally every day we eat, and therefore we always have opportunities to practice. Anything can be done mindfully. You can fill your dog's water bowl mindfully. You can tie your shoelace mindfully. You can fill up your car's gas tank mindfully. It's about what your intention is going into it and what do you really want to connect deeper with that experience? So I want you to think about the last time that you sat down in front of a meal or a snack that you were really looking forward to. I want you to think about, is this a time that you savored bites? Were you paying close attention to the sensations that you were experiencing? Were you alone? Were you with other people? Were you able to really savor it? Did you have to rush? So you may have noticed, even in that experience of reflection, that you may have noticed the stirring of hunger. You might have noticed some saliva start to pool in your mouth. You may have even noticed the urge to lick your lips. So we have instincts that are built into how we respond to some thoughts of hunger and eating, for example. So the sensory components of eating are smell, texture, sound, taste, and the feeling of the body, the food in your body. So learning mindful eating helps the person to connect more deeply with the process of eating and the sensations and outcomes of eating. And when we connect deeply, it allows us to identify satisfaction more easily and to experience satisfaction for longer periods of time. So we're going to discuss the hunger scale, and I'm always hangry. So that's my cartoon rendering of myself there. So what if I don't know if I'm hungry enough to have a snack or eat a meal? And believe it or not, I have a lot of clients, come to see me that will say, I never get hungry, or I never stop being hungry, or I don't really get full, or I don't have cravings. People have different perspectives and experiences around hunger. So believe it or not, it's really just not a straightforward concept, because everybody experiences it slightly differently. And especially in a world that is busy, stressful, chaotic, it can be really hard to gauge our hunger. So hunger and fullness signals are, at times different for different people. Meal skipping and chronic dieting will interfere with our hunger cues. And there are other factors as well that can play a role in how strongly or weakly we receive cues. So stress can play a big role, and stress is a big one for me, especially for breakfast. If I've woken up a little bit late in the morning, or if I have something really important I need to get there early in the morning for, I have to really, really talk myself down from, just grabbing a granola bar and running out the door. And if that's the best I can do, that's still better than nothing. But ultimately, I notice in myself that when I'm stressed or have something really important to me that I really need to deliver on, I very quickly lose my hunger cues. Strong feelings is another one, the lows, certainly for me. The opposite happens with high, strong feelings of anger for me. I want to crunch something. I really want that cathartic release. So it can be really helpful to even pay attention to how things play a role for you. Okay. So caffeine and nicotine are two things that can reduce and interfere with your hunger and appetite. Being unwell in general, but especially if that unwellness brings pain, depression, and gastrointestinal issues. And some recreational substances, for example, cannabis, will also either increase or decrease your hunger and fullness and your awareness of hunger and fullness. Actually, something that isn't on this list, and it's there as a prescribed stimulant, but even if you have something like ADHD and you don't take anything for management of your ADHD, hyperfocus and time blindness can also play a role in not being very aware of your hunger and fullness signals. So, neurodivergence can also play a role. So this is a snippet of a tool that they use from Alberta Health Services that I stole. But I like their hunger scale and the way that they categorize before and during and after eating. So ultimately, what I want you to notice is that this scale goes from 1, which is extremely hungry, up to 10, which is extremely full. And unfortunately, a lot of people kind of spend their time between 1, 2, and 3, and 8, 9, and 10, spending very little time in that 4 to 8 range. And the reality is that that's because they're not eating regularly. And when they do eat, they're not eating a balanced, adequate meal. I see a lot of people eating very little, if no breakfast, a snack lunch, and then being confused why they're starving all night long, especially because they probably had a stressful and busy day where they didn't receive, strong hunger cues, and therefore probably didn't eat as adequately as they might have. And then, of course, they're going to have delayed and deferred hunger later. But because they don't, they might have eaten a supper, they don't feel like they should have that hunger, and therefore they're confused by where this is coming from. So the other thing I want to kind of point out here is that if we constantly go between a 1 and a 10 or a 2 and a 9, we're going from really full to really hungry, back to really full, back to really hungry. And when we do that, we're asking a lot of our body to metabolize foods in a really quick way in a large quantity, which can overwhelm our system and not feel good physically or mentally. And then in the other side of that is that we're going without in the in-between, where we're feeling really, really hungry, which could be impacting our mood, our energy, our decision-making, our ability to concentrate. And we can be completely unaware of it. We can just be assuming that we just really want to get this thing done without realizing that we've gotten rigid about our decision and unable to be flexible. So on the top here, so it says aim to start eating around 3 to 4 when hunger starts. So you're starting to get hungry, your stomach might be growling, you might have had thoughts of food, you might be starting to think about what you might have, or looking or counting the amount of time between now and your next break or your next meal. That's when we really should be aiming to be eating within a short period of time. We want to try to limit extreme hunger of around 1 to 2 to avoid overeating. We want to try to stop eating around a 5 to 6 when we're starting to feel satisfied and comfortable. And we want to try to limit getting fullness up to an 8 or a 10, which is uncomfortably full or extremely full. So when we eat regular balanced meals that provide adequate nutrition, our hunger cues are much more reliable. And then because they're reliable, they actually remind us to stay on schedule with our eating, and it becomes something that generates momentum. And I always say, trust me, if you start eating regularly with consistency, your body will start sending you very reliable hunger cues, and it will help you stay on that pattern. So we are going to do a mindfulness practice, and then we are going to take a short break, and we will then start part 2. So I'm not going to do the mindfulness eating practice because I need to be able to speak to you. But what I would like for you to do is to now take the food that you've set aside at the beginning of the session, and we are going to begin our mindfulness practice so that you can experience what this might be like yourself and maybe even try it on your own. Start with eating somewhere calm and without distractions so that you can pay attention to your thoughts and feelings. It's okay if you're not really in an environment where you can do this right now. Think about this for the future. I want you to close your eyes and take a couple of cleansing breaths in and out, in through your nose and out through your mouth. So we're going to start with a nice inhale in, exhale out. Inhale in, exhale out. Try to empty your minds and give your focus entirely to this mindfulness eating practice. We're going to begin by picking up your piece of food. Examine its surface and look at its texture. How does it feel in your hand? Is it heavy? Is it light? Is it stable? Is it rolling around? Is it smooth? Is it rough? Can you imagine what it might feel like to touch it to your tongue or teeth? With nice, even breaths in through your nose, out through your mouth. I want you to slowly bring your piece of food up to your nose. Gently sniff and waft in its aroma. Does it bring up feelings or thoughts? Does it make you smile? Does it make you frown? What do you think of when you smell this food? Does it have thoughts that come with it, or is it a blank slate? Where has this food brought you before? When you're handling this food, does it make any sound in your fingers and hand? If you were to rub your finger along its side, do you hear anything? If you were to gently place it on the tip of your lips, holding it there for just a couple of seconds, do you notice any changes in your mouth, your sinuses, your throat, maybe even your stomach? Is there an instinctual pulling, asking you to continue to bring it forward? Have you noticed any saliva in your mouth? Any eagerness to take a deep smell in through your nose? Are you wanting to lick your tongue out to taste the food? Gently take that food into your mouth and slowly begin to roll it around on your tongue. Notice how that flavor and texture changes, and your saliva will start to come into contact with that food. All of the properties of the food are going to start to blend and balance, mixed with the flavors and the saliva. How does it taste now? Is it more enjoyable as you chew it more? Take your time. Make sure that you're having an opportunity to explore all of its textures, flavors, and aromas. Make sure it's fully chewed and you're ready before swallowing. And now take some time with your eyes closed after swallowing and notice, where does that feel in my body? Do I feel it settling it into my stomach? Does it feel good? Is my body asking for more? Take a couple more breaths in through your nose, out through your mouth, in through your nose, out through your mouth. Okay. On that note, I want you to take a few minutes break. I'm going to pause the recording myself, and I'm going to restart it in 4 or 5 minutes. I want you to take a nice 5-minute break, get up, shake your arms, swing your body around, work out the kinks, just get some blood circulation going, and just, clear out the cobwebs. And we're going to dive into the last half of this now, where we're going to talk about the practical side of what foods do we target, when, and how. See you in a couple minutes. Welcome back. For anyone who has never done a mindful eating practice before, it may have been surprising to you how much that changed the connection with your snack. And what I would say to that is that's something to explore and to take forward. Think about how it would change your satisfaction if, even every other day or every day, you were able to sit down and really deeply connect with what you were eating, how it felt, how you were enjoying it. And, you know, I, for example, really enjoy certain foods. So I want to make sure I'm in an area where I can savor those foods when I'm having the opportunity to eat them. And it really helps me appreciate the opportunity to eat that food more. So it's something to, you know, ask yourself, could I be doing this from time to time, especially if I'm struggling with my connection with food, my awareness of hunger and appetite, and especially if it's my difficulty recognizing fullness as I'm eating. Okay, so we are now going to focus on putting this into practice. So we're going to review nutrients that boost our mood, nutrients that might interfere with quality, adequate intake, and may be more inflammatory. How to make choices with carbohydrate-containing foods, regular eating and balanced appetite, balanced meal planning, hydration, and again, making change with SMART goals and some resources that might help us along our way. So, which nutrients have been shown to boost mood? So, besides the specific nutrients that we're going to look at in the next couple of slides, I did want to just quickly shout out to fermented foods. Fermented foods have been shown to be beneficial for mood. They promote more stable and healthy colonies of bacteria for our bodies. That in turn helps with our gut-brain axis, our immune system, our digestion. And so it's a cycle and a feedback system. Everything is connected, and you know, the bacteria in the fermented foods help our body function in a variety of different ways. So examples of fermented foods would be yogurt, sauerkraut, tempeh, sourdough bread, kimchi, kefir, and this is just some examples. Other things that come to mind would be like miso, for example, if you're someone who really enjoys like miso soup. So if you are somebody who is trying to strengthen your gut microbiome, improve your mental health, finding ways to include some fermented foods might be something you might like to consider. So over the next two slides, we're going to specifically discuss nutrients that have been connected to mental health and mood, and what the sources of those nutrients are. There is going to be a lot of detail on these slides. Do not feel like you need to write down every word of this. Feel free to take pictures, write notes, whatever. But I am going to give you an overview of this at the end, which is going to help you understand that you don't need to remember every single little detail on these slides. So starting off with omega-3 fats. And the two that are really star players here are DHA and EPA, which is docosahexaenoic acid and icosapentaenoic acid. And they play essential roles in our health, and we do not make them in adequate quantities within our body to be effective, so we have to get them through diet or supplements. So what do? They reduce the risk of heart disease, they help lower our triglyceride levels, they reduce inflammation, improves brain and eye maintenance and development. And the main sources in our diet are going to be fish and seafood, omega-3 fortified eggs, seaweed or kelp, and supplements. And if you are going to go the supplement route, it's really important that you choose a quality supplement. So, you know, talk to the pharmacist when you're picking one out, make sure that you're getting a quality one, or ask a dietitian. That's a great question to call 811 and ask a dietitian. But yeah, you know, we want to make sure that our omega-3 supplement is a source of DHA and EPA. And ideally, your daily dose when you take the supplement should total about 200 to 500 milligrams combined of DHA and EPA. So for vitamin B6, this helps your body make and use protein, glycogen, and hemoglobin, very important. And it also makes the parts that we need to make tissues and carry oxygen in our blood. So we get B6 from meat, fish, poultry, organ meats, soy products, whole grains, and enriched cereals. starchy vegetables like potatoes and bananas. Vitamin B12 works with folate to make new cells. You can imagine that we do need that. Maintains nerve and skin cells. So again, very important for proper nerve functioning. And we can get B12 from sources through meat, poultry, fish, and seafood, eggs and dairy products. If you're vegan, vegetarian, you often probably are relying on nutritional yeast or yeast spreads or taking a supplement. And plant-based dairy alternatives like soy and almond milk, which have to be fortified. So some people, depending on what medications they're on, may need to get B12 injections or take a supplement. But if you're trying to target it from diet, meat, poultry, fish, and seafood, eggs, dairy, and dairy alternatives. Vitamin B2, a building block for many other B vitamins like B3 and B6. So just like we talked about earlier, traffic jams in the body, if we're missing an important building block in a pathway, we can't move past that building block. So that's why it's so important for us to get a very wide, adequate, varied diet, because we can't keep moving past something that we don't have. So we get B2 from dairy, enriched cereals, meat and poultry, and green leafy vegetables and mushrooms. So vitamin D improves our calcium absorption from foods and protects us from infections. It's a very, very important nutrient diffusely throughout the body. So fatty fish like herring, salmon, and trout are sources, egg yolks. But vitamin D has to be fortified in our diet, and we in Canada do that through dairy and margarine. And it also is really important for us to consider a supplement, especially if we have, we should just consider a supplement anyway. Most people over the age of 50 are recommended to take a supplement, but even people who are younger than 50, there are lots of reasons why you should probably be taking a supplement. So usually you're going to see people recommended to take between 1 and 2,000 international units. I usually recommend people take vitamin D3 and take it in a complex with K2, because that improves how you're actually using the vitamin D, especially if you're not someone who has leafy greens in your diet. If you're someone who is taking warfarin and has to be mindful of vitamin K, that's a different story and a little bit more of a complex situation. So folic acid and folate. Sorry, I'm moving on without you guys. Sorry. Folic acid and folate helps produce skin and tissue cells. It's really important in pregnancy and breastfeeding. It helps prevent anemia. It lowers the risk of birth defects. You're going to find it in sources like liver, edamame, and other legumes, beans, peas, and lentils, green veggies, like spinach, romaine, lettuce, asparagus, broccoli, Brussels sprouts, enriched grain products, flax seeds, sunflower seeds. Very, very important. Iron. I'm sure lots of you guys have heard of someone or known someone who had low iron before. It's very important for carrying oxygen in our blood. It's involved in our energy balance. It helps build DNA. It improves our immune function, and we get it through both animal and plant-based sources in the diet. So from animal sources, it's called heme iron, and for plant sources, it's called non-heme iron. And for animals, you're going to get it from meat, fish, poultry, and from plants, it's going to be more beans, peas, lentils, dried fruits, fortified grain products. And for the plant-based version of iron, it's important for you to consume that along with sources of vitamin C, as there's some evidence that that improves the absorption. Selenium. It's an antioxidant that helps keep our tissues healthy and prevents cell damage, and it can support a healthy immune system. A good source would be nuts, especially Brazil nuts, but I do have in brackets there that Brazil nuts can be quite potent in selenium. So you're really only recommended to have 1 to 3 a day. And if you're eating 5 a day, it can actually get to toxic levels and it's not recommended. So be mindful. So supporting, it supports your immune system. Sources would be seafood, meat, eggs, and nuts. Zinc. Zinc, I get a lot of questions about, especially since COVID. So it supports growth and development in utero and development through developmental years. It maintains a healthy immune system and supports wound healing. It helps the body make protein structures, and deficiency can impact your smell and taste, which is one of the reasons why a lot of people wanted to discuss it during COVID. So the thing is that if you are supplementing with zinc and only zinc, you can actually interfere with the absorption of other important nutrients like copper. So it is much better for you to get your zinc through food sources and only take zinc supplementation if there is a known deficiency or reason to believe there is a deficiency. So meat and seafood, especially shellfish, are good sources. Whole grain foods and fortified foods, cereals, and some seeds like pumpkin and nuts. So again, what we said was that we would have a moment where we kind of reflect back and understand how we can remember this information. So if I go and I toggle back and forth between these two slides, you're going to consistently see recommendations to eat protein sources, protein foods, which would be like your meat, your fish, your dairy, your eggs, your fish, your nuts, your seeds, your beans, peas, and lentils, your fruits and vegetables, and your grains, right? Those are the three things that you're consistently recommended to have. And so that just happens to be exactly what Canada's Food Guide recommends. And there's a reason that we designed the food guide that way. It's because we know that with meals balanced such as it is recommended in the food guide, you will get an adequate amount of these nutrients. So diets that follow Canada's food guide properly, as is recommended through, the review we're going to talk about today, you are already eating all of the sources of these nutrients. The problem is when the diet is comprised of highly processed, highly refined foods that are really low in these nutrients, that's when we start to see imbalances and inadequacies in the diet. So we've talked about what foods we need to target. So, and we are going to actually go into that in much more depth after this next section. And so how do we target these foods with meal balance? And in what ratios should we be eating these foods? All of that we're going to discuss in a minute. But before we do that, I want to talk about another concept of what foods should we moderate or limit. So I very specifically chose this graphic because these rocks, you see these great big rocks that are kind of balanced with these smaller little pebbles kind of in between. And if I was to take those little small pebbles out, you would probably still find a way for those bigger ones to balance. But it wouldn't be so pretty. It wouldn't be so tall or as wide, right? So ultimately, the metaphor I'm trying to kind of connect here is that when we eat all of the foods that we're recommended to eat, the protein foods, the whole grains, the fruits and vegetables, the dairy or alternatives, those things that ensure that we get adequate nutrition, the choices that we make for enjoyment are the little pebbles shoved in the between. That's what really fills out our life, gives us all of that joy and enjoyment and satisfaction, and helps us go further, go farther, reach wider, and really shine. Okay, it's just when the balance is off is when we need to be concerned. So having the majority of our diet anchored around these really important sources of nutrients, and then filtering in the odd ice cream or chocolate bar or bag of chips or wings and fries or beer out with your friends on Saturday night, that isn't what gets you. It's when you don't have the structure and the important components to build the whole picture, okay? So I don't go through these foods to moderate or limit because I want you to focus entirely on this. I want you to understand it all needs to balance. So foods and nutrients that we need to moderate. Caffeine. Reasons being is that it increases anxiety, it suppresses appetite, it disturbs our hunger cues, it increases GI issues like reflux and diarrhea. Sources of caffeine would be tea, coffee, chocolate, flavorings, energy drinks, pre-workout products. So ultimately, we are recommended to limit our caffeine intake to 400 milligrams per day or 300 milligrams per day if you're pregnant or trying or breastfeeding. The other thing I always like to try to mention is beyond just the impact on our, our appetite, our hunger, and our digestion, caffeine also has diffuse impacts across our organ systems elsewhere. Just as an example, if you're somebody who drinks a lot of caffeine, you are going to excrete more calcium. So you're going to be at higher risk of bone loss. So it's important for you, or bone mineral loss, sorry. So it's important for you to, be aware of your caffeine intake. How close or far away are you from 400 milligrams a day? And is that something you could set a goal around? Alcohol. So there's no safe amount or recommended amount of alcohol to consume that doesn't come along with risk. That's important to kind of understand because Health Canada has shifted its position on that in the last 5 to 7 years. It used to be that they would recommend, 1 to 3 drinks a week or something like that. But they've since, looked at the vastness of the evidence and decided there really isn't a safe amount to recommend without any risk. So as you can see, studies that have shown individuals with regular patterns of alcohol consumption are going to have lower levels of serotonin and higher rates of depression or low mood. So it's a good idea to pay attention. Like, am I someone who drinks every day? Am I someone who drinks multiple drinks every day? Could I take a break and not drink every day? Could I set a goal or a limit around 1 or 2 drinks in a night? Or maybe, I only have something on the weekends. Could I set a guideline or a parameter around my intake in a way that makes me more comfortable? So on the left here of this graphic, you're going to see it kind of goes from 0 drinks a week down to up to 7 or more standard drinks a week. And as the number of drinks a week increases, your risk also increases. So as, when we're having like 1 or 2 drinks a week, it might interfere with our sleep. It might interfere with our appetite. It might cause us to be more, swollen or lower mood or things like that. But if that's like an everyday occurrence, and certainly once we start getting into high amounts of intake, the risk compounds, okay? So it increases in the complexity of the risk and the seriousness of the risk. So foods and nutrients to moderate saturated and trans fats. So processed meats and trans fats can increase inflammation. We are recommended to avoid trans fats and limit saturated fat in processed meats. So trans fats occur in small amounts naturally in ruminant animals, dairy, beef, and lamb. That's not the kind that are created by the food industry. It's very tiny amounts, and it doesn't require any kind of panic on our part. Canada has now restricted the addition of partially hydrogenated oils to products in Canada to make the amount in our food supply of trans fat to be as minimal as possible. It used to be that hydrogenation was something that was done to allow products to last longer on the shelves and to be able to be repeatedly refried without losing a lot of the sensory components that people wanted to experience. So it's important to understand that currently in Canada, it's not actually okay, like for the food industry to add in trans fats. So if it's going to be there in Canada, it's likely there naturally, but you have to be careful of imported foods and foods that are, imported foods are the big ones, or foods that don't come with like normal food labeling. So processed meats. Processed meats are rich in saturated fats, can have trans fats, but they also contain nitrites and nitrates, which can create problems in our body, increasing our cancer risk, increasing inflammation, And so again, we need to be cautious of processed meats. So we're always trying to ask people to look for an alternative to processed meats if there's someone who has a daily pattern or even an every other day pattern of eating processed meats. Processed meats are going to be your bacon, your bologna, your sausage, your deli meats, your your wieners, all of those kinds of things. So instead of your ham sandwich, could you have an egg salad sandwich? Could you have a tuna sandwich? Could you use leftover meats? Could you have a peanut butter and jam sandwich? There are other alternatives than always reaching for the deli meat or the processed meat. Can we do that more often? Not all the time, but more often. So not specifically a nutrient that we need to avoid, but a nutrient or something that is nourishing itself is social connection. So loneliness is connected with, less beneficial patterns of self-care, declining health, declining mood, declining mental health. So it's really important to have things in place that allow you to connect with others, especially at meal times. So if you're someone who eats alone frequently, try to find a way to eat with friends and family more often. Maybe you could do a virtual supper date. You could join a community meal. You could start a supper club. You could start a buying, even a meal prep club, and that could serve multiple purposes. I often find that the people who are most vulnerable to loneliness are the people who would benefit most from joining, a group buying shopping trip, or, getting involved in a community group or a community program. So is there a link worker you could call to explore social community groups? Is there a 50 plus club you could join? Is there a hobby you could join? Is there an exercise group you could join? Anything that gets you more community and more socialization and more opportunity for you to connect with others around meal times. So I often speak to people who are above the age of 50, but whenever I have the opportunity, I always want to help people understand it's really important to eat together as a family or as a group as often as you can. It's particularly important during developmental years of childhood, adolescence, and the teen years. And there's been a lot of research and studies, go into trying to look at how that strengthens somebody's relationship with food, strengthens their patterns of self-care, and results in lower rates of complex disease, chronic diseases, mortality. So getting into the nuts and bolts of things here now. So we talked about, which nutrients are really important to make sure that we get because, they serve essential components in our body, which are connected to our mental health and mood. But, on a grander scale, we got to talk about carbohydrates and proteins and fats. So when we're choosing carbohydrates, it's a great idea to think about balance. Grains and starches are, one of the more common, what usually make up the majority of the energy that we get from carbohydrates. So we want to know how to choose a carbohydrate with quality in mind. So different carbohydrates digest and absorb differently. Some are already in a very simple form and they can go quickly, like added sugars, syrups, honeys, sodas, candies, icing, or natural sugars, or highly refined or processed grains and starches like minute rice, breakfast cereals, white bread, rice crackers, baked chips, those kinds of things. So whole grain foods, on the other hand, typically digest slow and they absorb more slowly. They're richer in protein, fiber, antioxidants, vitamins, minerals. They're lower in glycemic index. And starchy vegetables, especially when they're in their whole form with skins on, are also a really great source of carbohydrates that digest slowly and gives us more long-lasting satisfaction and more improved nutritional intake. So even if we just challenge ourselves to swap out some of the more highly refined versions of grains and starches that we choose more often and replace it with something that's more minimally processed, that is a big step to take in slowing down how much of an overwhelm there is for our bloodstream after eating, which can help us feel better, maintain a more even mood, and actually encourage us to stay in a regular pattern of balanced meals for the rest of the day, rather than that big rise in blood sugar and then crash that can leave us feeling like, ugh, you know, which then sometimes makes us feel like, well, today is shot. We might as well just think about, you know, health and wellness tomorrow. So whole grains and minimally processed choices is what we recommend most often. They give us longer lasting energy and they help us stay satisfied between meals. They provide us with more even mood, feel more comfortable in our bodies. A whole grain is different than a refined grain because it has the bran and germ layer components intact. They're higher in fiber, protein, vitamins, minerals, omega-3s. So look for whole grains as the first ingredient when possible. And whole grain is not equal to whole wheat. It's really important that we don't assume that because something is whole wheat, it's automatically whole grain. So you need to check to see it says either 100% whole grains on the package, or in the ingredient list at the beginning of the ingredient, it says whole grain, whole wheat flour as the first ingredient, instead of just whole wheat flour. So some foods are already a whole grain. They themselves are a whole grain. So oats and oatmeal, cornmeal, popcorn, quinoa, wild or brown rice. So it's important to understand that if it's wheat, rye, or barley, you want to see the word whole grain, whole wheat, whole grain, whole barley, whole grain, whole rye, or whole rye or whole barley. But if it's oats, cornmeal, popcorn, quinoa, wild or brown rice, those words are whole grain. They don't require the word whole grain in front of them. So if something says multigrain, that means there are multiple types of grains. That does not mean that any of those are whole grain. If it says multigrain and the first ingredient is whole grain, whole wheat, and brown rice, that's 2 whole grains as the first 2 whole ingredients. So chances are, you know, it's mostly a whole grain product. You just have to be a little bit more discerning when you're picking things out because they do not make it very clear or easy for you. So I always, I'll just go through this little piece here now just because I think it's important. I don't always choose whole grains. I love Toutons. I love cookies. I love chocolate bars. I love Fruit Loops. I love Cinnamon Toast Crunch, okay? So sometimes I'm going to choose the non-whole grain version because it's what I want. It's what suits me best in that moment. Maybe it's the best decision available to me. But what I'm talking about doing is making a concerted effort every day that when you have the option to include more whole grains, you're making an effort to do so. And then when someone offers you a cupcake at work, or there's birthday cake, or you know, you're on your way to St. John's if you're not a townie, and you know, you got your coffee and your donut on the road because that's what you always do. You know, those are not the things that get us. It's the stuff that we form the structure around our meal pattern. So, you know, our grains and starches with our meals, what are they? What are we choosing most often? Is there something we can shift so that we are choosing something more in lines with our goals more often? So if I didn't like brown rice or wild rice, for example, instead of choosing minute rice, maybe I could go with the long grain white rice, which is just not quite as processed. Maybe I can even go add in some wild rice because I like wild rice, and maybe it's the best of both worlds. Maybe I do white rice mixed with lentils because lentils are high in fiber and high in protein, and that way I get lentils and rice, and I can have something that is, you know, slow to digest and absorb and more satisfying. So there's no perfect choice, and perfection doesn't exist. It genuinely isn't real. So if perfection doesn't exist, what are we aiming for? We're aiming for improvement. Improvement genuinely does exist. So we don't want to get to the end goal right away. We just want to take that one step forward. So refined grains are often culturally important to us, like Toutons and blueberry pie. We just talked about this. Approaches to eating that are too rigid are not only unnecessary, they are harmful. So we don't want rigid rules. We want guidelines, okay? Instead, prioritize nourishing and balanced eating more often, and this has a variety of benefits to our mood and to our health. So again, that's why I have this, this graphic here. These are the whole grains in here. And like that's your Timbit and that's your pancakes on Sunday morning, okay? So it's about the balance, and it's about doing what's in line with your recommendations most of the time or more of the time, and doing what's kind of not necessarily a choice for health, but for enjoyment less often. So all or nothing approaches to nutrition guidelines and appetite often leave us either feeling too full or too hungry. Too many rules to follow can often lead us feeling unable to make a decision at all, unable to choose what to eat. And having no guidelines or intentions with our eating can also be a problem. Our goal is to develop a pattern that is adequate, regular, and supportive. And we're going to do that through discussing regular meals. There are lots of diet trends that encourage fasting, meal skipping, or counting, eating a rigid number of calories, weighing and measuring everything you eat, all kinds of different things. And it can often create an all or nothing approach to eating that can just cause harmful intake patterns, low in nutrition quality. It can also be high in energy and promote weight gain and chronic conditions rather than health. So, prime example would be, I've had patients come in and tell me, well, I'm intermittent fasting. By the time, my lunchtime comes, I don't eat my breakfast. By the time lunchtime comes, I'm so sick that the only thing I can eat is like French fries, right? So how did that intermittent fasting align with making a decision more centered on wellness and health? It didn't. It left that person feeling on the extremes of the hunger scale and unable to make a decision in alignment with their nutrition goals. So eating regularly, on the other hand, can improve mood and overall health. So we recommend eating within 1 to 2 hours of waking, ideally closer to one rather than two. And we want people eating every 4 to 6 hours and including a snack between meals if you're hungry, using more energy than usual, or struggling with inadequate intake. So especially if it's closer to 6 hours between meals, I would be very, very hungry in between meals if it was 6 full hours, if I'm working, active, doing chores, doing errands. So I really think that we need to get away from this concept that being on the edge of scary hunger is actually in alignment with being healthy or being more well. It just sets us up for failure. So if we want to avoid being on the extreme ends of the hunger scale, we've got to eat more regularly in order to moderate and make more consistent our appetite, our hunger, and our fullness cues. So again, aiming to, as soon as you start if you're eating every 4 to 6 hours, you're not actually getting an opportunity to get to an extreme hunger. And then likely not going to eat until you're extremely full. You're going to experience less digestive issues. You're going to experience more stable metabolism. And eventually, over time, the adequacy and the consistency of your pattern will support more even balanced mood, more reliable hunger and fullness, and more even appetite. So balanced meals. So something is always better than nothing. Making the best decision that we have available to us is usually the only option we have. But when we do have the opportunity, the energy, the mood, the time, the financial means to address and improve the balance of our meals, we are increasing the chances that we are going to eat adequate nutrition. We're going to have a more balanced mood, more improved energy, a normal appetite, and just overall better health. And if you're noticing that Canada's Food Guide looks a little bit different to you than what you remember, it's because it got a little bit of a revamp around sometime between 2017 and 2019. I need to look up my dates. But so we got a revamp, and we reconfigured it to be more simplified and also more specific. We always had recommendations about what to eat. We didn't really have any specifics in there about when, in what balance, those kinds of things. So now we have this Canada's Food Guide, Eat Well, Live Well, and the balanced plate is the guide. So what you're seeing in front of you is that half of that plate is fruits and vegetables on the left. The top quarter of the plate on the right is protein foods, and the bottom quarter of the right is whole grain foods. So I'm also going to put starchy vegetables down in that corner as well, just for the purposes of today's conversation. So down here, where it says choose whole grain foods, I like to just write in and starchy vegetables. And I like to keep my non-starchy vegetables and my fruits on this side of the plate. And I like to keep my starchy vegetables and whole grains down in this corner right here. That's consistent with what we usually recommend for people with diabetes management as well. And I think that just from the point of view of balancing the plate and knowing how to kind of ensure that you're getting enough carbohydrates, all of that stuff, it's important for us to kind of keep those two sections consistent, or that one section consistent. So fruits and vegetables, they're rich in fiber, vitamins, minerals, hydration, phytosterols, many other important nutrients. Protein foods help us with satisfaction, help us last longer between meals. They provide the building blocks that we need to maintain and repair and build tissues, and to produce things like hormones and serotonin. Our whole grains and minimally processed starches provide us with energy, vitamins, minerals, and fiber, support us to use our protein and vitamins and minerals in all the ways our body needs to, supports a healthy gut microbiome, helps us get enough antioxidants as well. And it's really important to note that if we're shifting the balance of this plate, especially if it's happening in a regular pattern, we can get excessive amounts of some nutrients and inadequate amounts of others. And over time, that can accumulate into deficiencies and toxicities. Well, not so much toxicities, but more issues with deficiencies over time. And we more likely experience disease when it's toxicities over time. So eating with this balance gives us a lifted mood, satisfies us for longer between meals, improves our metabolism, stabilizes our weight. It promotes healthy digestion, and it's also a sustainable approach which can be flexible for any number of situations rather than rigid rules that sometimes work and sometimes just aren't sustainable. So you can use this balance and this approach with any meal. And I'm going to give you some examples now over not the next slide, but in the next couple slides. So when we're plating our meal or planning our meals, how do we check in to make sure we're choosing the right types of foods and eating them in the right amounts more often? So we can try asking ourselves a few key questions. What can I have for fruits and vegetables with this meal? So let's say right now, things being what they are, you've got a bologna sandwich for lunch. And so your bologna sandwich, you're going to have, is it in line with exactly what we're talking about today? No, but it is in line with the fact that we don't always get to make perfect choices. So today we're talking about if someone gave us a bologna sandwich for lunch, and that's what we're starting with. So we've got our 2 slices of bread, which is, ideally whole grain bread, but could just be your straight up white bread if that's what you have. But again, this is an opportunity to improve balance. If someone asks you, do you want it on white or whole wheat or whole grain? You can say, oh, I'll have it on whole grain. So then you're going to have your 2 slices of whole grain bread here, your 2 slices of white bread. That's 1/4 of your meal. And then your bologna up here is going to be roughly, I don't know actually off the top of my head how good the quality of protein is in bologna, but it's a source of protein. It's going to be the 1/4 of your plate up here. So what's missing is your fruits and vegetables. So you could do, a cup of vegetable soup. You could have some coleslaw. You could have a bowl of blueberries and like a garden salad. You could do, You could just do sliced up cucumbers and cherry tomatoes dipped in dip. It does not need to be rocket science. The thing is, whatever you're starting with, how do I add the value to it in order to improve the balance? So other questions you could ask is, where is my protein? So let's just say, you know, you come down over the stairs on the weekend visiting your sister, and she's got a nice salad made with you. She made nice salads for lunch, and it's just vegetables. There's no protein, there's no grains in it. So then you can say, all right, well, you know, easiest thing for me to do would just be to have a couple slices of peanut butter toast on the side. Okay, I've got the peanut butter, 2 tablespoons peanut butter is my protein, and then the 2 slices of toast is my grains and starches. Or maybe she has some leftover rice in the fridge, and you just want to throw some of it into the oven and toast it and have that over the top of your salad. There is no right or wrong answer. There's no one size fits one person. You know, we can adapt and evolve our approach to this based on what our choices are and what our goals are. Our goal is balance and adequacy and regularity. I want to eat regular meals. I want those meals to be balanced with half my plate as fruits and vegetables, a quarter as grains and starches, a quarter as protein foods. And I want those foods to be the best quality available to me more often. Those are my goals. So where's my protein? What am I having for grains with this meal? Have I had any whole grains today? Where can I add value to what I've already started with? Am I missing important parts of my nutrition at multiple meals or snacks today? What should I prioritize at my next meal or snack to help me meet my needs today? Okay, so you're checking in, you're reflecting on, what is this meal? How does this meal relate to my whole day, what I've already eaten, what I might be eating later? What have I been missing out on lately that I might need to prioritize? What have I been getting too much that I might want to moderate? Checking in is a very important task. So I just threw together a couple of slides here with some examples of balanced meals as per Canada's Food Guide, as per the Balanced Plate. So again, we've got our grains and starches, and if you look closely, you'll see with this breakfast bowl here, we've got a granola, milk, and berries, and some raisins. So we've got our grains and starches with the granola. There's some nuts in there, which also provides some protein, and the milk provides the protein. And then we've got berries on the side there, which is our fruit or vegetable. Then in the middle, we've got some scrambled eggs with sauteed greens, and that looks like tomatoes and mushrooms and onions with avocado. I'm so hungry. Oh God. So all of this looks amazing. But so what I want you to kind of take away from these pictures is that these are balanced meals that are always including grains and starches, protein foods with fruits and vegetables. Everything on those plates serves an essential role, and everything works better when the other elements are there. If we only eat carbs, there's no protein or fiber of any amount to slow down the digestion and absorption of the carbohydrates. It's going to hit our bloodstream really quickly. Adding in the protein and the fiber of the fruits and vegetables dramatically slows down how we can digest and absorb that meal. We have to think about balance. So here we have some lunches. So in the middle, we've got some pasta salad with bocconcini balls. It looks like maybe some salami, veggies in there. Fun fact, pasta is lower in glycemic index when it's eaten as a leftover and when it's eaten as cold. When it's eaten as a cold leftover in pasta salad, when it's paired with lean protein and non-starchy vegetables like you see here, it's quite the combination for long-lasting, really satisfying nutrition. You see a little snack lunch here on the left. I'm famous for bringing in these snack lunches. I do love a snack lunch. And I'd love a noodle bowl. Anyway, like I said, I'm starving. But the major components are always here in these meals. There's grains and starches. There's fruits and vegetables. There's protein foods. So again, dinner, we see down here, we see a burger. It looks like maybe a vegetarian burger with a salad. The burger bun itself is the grain and starch here. And then on top, you see it looks like a steak medallion with some rice and sauteed vegetables on the side. But again, it's all about the balance. These meals are so nourishing, they're so satisfying, and they are perfectly designed to improve your wellness and help you regulate mood and energy. Hydration. So I specifically wrote adequate hydration here because it is really important to understand that there is no benefit in consuming excessive hydration. Just give me 1 second. Sorry, I had to do a quick pause. So there's no benefit in excessive hydration, and there are harms done. You are overworking organs that already have quite a lot to do. So our fluid intake is important, and it helps us with moving nutrients and waste throughout the body, keeping our blood pressure normal, protecting and cushioning joints and organs. It helps us maintain a normal body temperature. It lowers your risk of dehydration and heat stroke. So our fluid and our adequate intake of fluids is quite important. It is really important that we do not we don't forget about hydration. And there are lots of people that do. There are lots of people that come in and tell me like, and hey, I'm guilty. I can sometimes go home and I'm like, God, I've got a headache. And then I think about it and I'm like, well, I did only drink caffeinated beverages today. So that's on me. So, and here's the thing is that at that point, what my instinct to do is to just down tons of fluid. But your body really kind of needs you to gently rehydrate you in order to get the best bang for you. So you don't want to just like guzzle it all at once. You want to kind of just start sipping and intentfully hydrate through the rest of the evening. So, oh, sorry, I'm after going off of my presentation. There we go. So if you're someone that struggles with hydration, it could be really important for you to be aware of the signs and symptoms of dehydration so that you can quickly spot it. So thirst is one that people commonly talk about, dry lips and mouth. Once you're thirsty and you have dry lips and mouth, you're already dehydrated, right? So I always like to encourage people, like, try not to get to dehydration. Don't wait for those things to be there before you start focusing on hydration. So flushed skin, headache, my common indicator, dizziness and fainting, dark and strong smelling urine, low blood pressure, increased heart rate. So when you wake up in the morning, I would anticipate that your urine is going to be darker and more strongly smelling because you've slept for an extended period of time where a lot of metabolic processes and waste products were processed and built. So, but through the day, it should lighten up, right? So your urine should be somewhere around here, here in the good or fair section. We don't want you kind of down around here. So if you're seeing your urine like that and you don't have a known medical reason why it would be like that, and your medical team isn't aware of how dark and strong your urine is, you should definitely mention that during your routine follow-ups. And but yeah, so drinking 6 to 8 glasses, 8-ounce glasses a day is a good goal for women. 12 to 13 if you're breastfeeding. 8 to 13 glasses a day for men. And again, I don't love the men versus women designation. It really depends on what your body shape and size is, what kind of activity you're doing, the environment that you're working in. So the best indicator of your your needs is how much you've already consumed. If you're showing any signs or symptoms, your urine color. But if you're tired, lightheaded, and having difficulty focusing, hydration might help, right? So choose water most often. Milk, juice, tea, and coffee can also count towards our fluid intake. Limit caffeinated and soft drinks to something that you choose sometimes, not always. And if you're drinking a lot of soft drinks, make sure, especially if you're somebody who has pre-diabetes or diabetes, that you're not drinking a lot of regular soft drinks. With soft drinks, I like to think of them as like enjoyment foods. If you really enjoy a soft drink, just try not to have multiple soft drinks a day, or maybe even some days of the week that you don't have them. whatever your current pattern is, just, think about setting a moderate limit around it. If you're somebody who has high activity level or work in a really physical job, in hot weather, in a dry environment, you may need more fluids than the average person. So it could also be that you don't need regular water. You might need something called an oral rehydration solution. So if you're like a construction worker out working on the highways during the summer, up on a roof, if you're a nurse working at the Miller Center in the heat over there, any number of places where you're working, you have limited access to fluids, and you are doing a lot of sweating in a hot, dry environment, you might want to have an oral rehydration solution on hand. And that would be like your Pedialyte, your Gatorade, or similar products. And sometimes what helps if you have like a locker is just to keep the container of the powdered stuff so that you can make it as you need it. Okay, or if you're someone who has like IBS, for example, or inflammatory bowel disease, and you could have a lot of nausea and vomiting and diarrhea, it's definitely important for you to have something like an oral rehydration solution available to you so that on your bad days, you can help yourself stay adequately hydrated. Oh my goodness, that was a lot of information. So just to recap here now, the sources of important nutrients are protein foods, whole grains, fruits, and vegetables. The best nutrition comes when foods are minimally processed. However, I say that with the caveat that even minimally processed or processed versions of nutrients are better than no nutrients. So, if your decision is, well, I'm not going to eat, I don't want to get those, that meal because they cooked those carrots and that broccoli versus, this one, the one I wanted, which isn't on the menu, had it raw. Well, them steaming the broccoli and carrots, even though it's processing, didn't reduce the value of eating those. It might have altered a tiny little bit of the nutrients in there, not enough to negate the value of eating that broccoli and that carrot, okay? So minimally processed from the point of view of there's a big difference between eating a baked potato and eating a baked lay, okay? So, find the middle, find the compromise in the middle. A diet that is regular and balanced already supports adequate intake of important nutrients on a regular basis. That will in turn improve health, mood, energy, and quality of life. If you rely heavily on caffeine, alcohol, nicotine, protein drinks, protein bars, drive-through takeout in order to get through your day, it could dramatically be impacting the evenness and quality of your health and mood. SMART goals. So before we start talking about setting goals, I want to talk about change. Change is something that we may even be aware we need to make a change, or that other people think we need to make a change, but we might not be ready to make that change ourselves. Change happens most effectively when we are ready and motivated to make that change. Readiness and motivation changes all the time. Thank God it does, because that's what gets us to a place where we're actually thinking about change or ready to make those changes, is the ability to get to that place. But just like we got from, not being aware we needed to make a change and now thinking about making that change, we might get frustrated or unfocused with that change and become less ready and less motivated over time. It's supposed to happen, and it's not bad if it does happen. It doesn't mean you failed. It doesn't mean that it's not working. It doesn't mean it won't work. It just means you need a break, or you need to refocus or reconfigure. Setting SMART goals helps people stay focused on change, but it's not the only thing. And we're going to talk about how to make SMART goals. But if your readiness to make change is there today, you're eager, you're fired up, this talk really got you thinking, and then next week you are frustrated with the lack of action on your part, I want you to remember that that's normal. It would actually be unusual if you had heard one conversation with a dietitian and then were able to just enact every guideline for the rest of your life. So please start with smartly set goals that are reasonable and meaningful. So S stands for specific, a detailed goal that includes the what, when, how, and who. M is measurable or monitorable. How often, how much, how are we going to know it's working? Action-oriented, focuses on a specific pattern or behavior. So, I'm not just having a vague, like, I'm going to be more healthy. I'm going to specifically talk about what actions and behaviors are going to be attached to that statement. Realistic. There's no point for me to set a goal that I'm going to be the best single trail biker for, women in all of Newfoundland. I've never even competed before. So we have to start somewhere. We have to start with a reasonable, attainable, meaningful goal. It might be more realistic for me to set the goal to enter a race, right? So time framed, how long will we work on this before we expect to see results or change? And that also feeds into the monitoring or measurable. Like, when am I checking back on this? When am I reviewing to see whether or not I'm moving forward, staying the same, or moving back? Okay. So as an example, a smartly set goal, there's one on the top of the page there. But if I had just said I'm going to eat more vegetables or I'm going to eat more whole grains, that is a goal, but it's really vague. If I say I'm going to eat a serving of whole grains with my lunch 3 days of the work week, that's specific, measurable, action-oriented, realistic, and in a specific time frame. I can monitor that. I can track that. I have a plan. I have a goal. It can be really helpful before you even get started with setting goals to sit down and make a list of what you're doing well. I talk about this with patients that are feeling like it's a big uphill climb all the time. Everything feels like an uphill climb when you're standing at the bottom of the hill, right? So it really helps to make a note or take stock of what you've already done. If you're someone who is trying to, tackle your regular eating, instead of setting the goal of, oh, well, I'm going to eat my breakfast, blah, 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 blah. First of all, I want you to make note of, well, my supper is super consistent. I do that every single night at relatively the same time, and I eat with my family. That's like really beneficial. So my lunch is a bit hit or miss. I go sometimes, and I usually eat with my coworkers. So first, I'm going to make note of the fact that my supper is really consistent, and I'm going to make note of the fact that my lunch is inconsistent. So I'm already making note of where I am, I'm taking stock, and I'm appreciating the work I've already put in and where we're at currently. Because if I was to assume that my lunch was always consistent, even though it's not, I might not be realizing work that needs to be done down the road or an opportunity to set a goal. And if I'm not addressing the fact that I'm eating supper every single night, I'm potentially not really realizing that I've already got things moving in the right direction and I don't have to start from the bare scratch, okay? So it can be helpful to switch up your goals every few weeks to keep things fresh, and that helps you keep on working what's meaningful or relevant to you right now. I don't recommend setting more than 1 or 2 goals at a time. It's okay to have like kind of more overarching goals, but really specific SMART goals, I would try not to set more than 1 or 2 at a time. There's too much to monitor and evaluate. Remember that motivation and readiness are supposed to fluctuate. It can fade and it can also strengthen. So just like you lost your motivation, you can get it back, okay? Just like the worst times in your life never lasted, neither can the best times. The only thing that's guaranteed is change. So habit trackers, apps, and journals. So I just threw an example up here of a habit tracker. I find habit trackers really helpful, and I like it because it's focused on the habit and not on the numbers or the calories or the weight or, the inches or whatever. So it's focusing specifically on habits. So there are different apps that you can use that will help you set good habits, and Habitca, I think, is one that comes to mind. Habitca, I think it's called. And so that's one where it basically treats you like you're a Tamagotchi. I don't know if there's any 90s kids here, but like a pocket pet where they treat you like you're a pet and you have to feed and take care of your pet, and you get gold, or you get points, or you get acknowledgement when you feed or take care of yourself. So that's a really good one for setting very basic self-care goals. But habit trackers can be an analog way of doing that, where I find it, if you're someone who likes the tangible paper in front of you, a habit tracker can be a really nice way to do it. And so in this case, the habits that I set up was to go for a walk for 30 minutes in the afternoon, to have a serving of whole grains at lunch, to drink water in the morning, and to go to bed by 10:30. And so again, going back to my previous guidance of 1 to 2 goals at a time, it could be that I've already nailed these 2 goals and it's just something I'm maintaining. And I might have just added in these goals just to kind of move on. Okay. All right. Journaling can be really helpful too, especially if you're exploring your relationship or connection with food. But again, it can also be heavy. So you want to have a transition plan for something nice to do for yourself afterwards. So I wanted to just end off with a few reliable nutrition resources. So you can always dial a dietitian in this province. There's a dietitian service connected to 811. And for questions like, how do I choose an omega-3 supplement? Am I, getting enough fiber? I'm having constipation. My doctor just told me I have prediabetes. All of these kinds of things, you can dial a dietitian, and you can bring any number of those issues forward. And if they can't manage it in the 811 space, they'll contact, someone else to try to figure out where that referral can go. So family care teams, if you're in primary care, if you have a physician who is connected to a family care team, then you can be referred and seen within the family care teams. In some places, you can actually see the family care team dietitian if you're not connected, but for the most part, you have to be connected. So there are private pay dietitian services in the province. You can always go to the Newfoundland and Labrador College of Dietitians website to find a list of private pay dietitians. And outpatient services, depending on the location you live in and the reason for your referral, there might be an outpatient service for you. There's very limited options in the province, but there are some that do exist. And again, you miss 100% of the shots that you don't take. So, always ask, what's the worst that can happen? Is they can say no, and then you call 811. Okay, so reliable websites, you can go to unlockfood.ca, hi.easternhealth.ca is another really good one. And the Food Guide website has a lot of different sites you can navigate to, where they kind of explore those topics more, like balancing meals, shopping, quick and easy meals, like all of those things. So lastly, thank you so much for your interest in this topic. Thank you for your interest in taking care of yourself, and genuinely best wishes on making change and having fun with it. I've always been really passionate about this topic, and I do genuinely believe that we can live better, more quality lives when we don't try to control our body, and instead we try to nourish it and support it. So, we deserve food, rest, hydration. We deserve to eat foods we love and foods that make us feel well. So good luck finding the balance. Thanks so much, and have a great day.